British Columbia is facing a public health emergency. Large numbers of people are dying from illicit drug overdoses.
The criminal justice approach of penalizing illicit drug users to discourage drug use and remove access to drugs through incarceration does not seem to work. Imprisonment rates have been on the rise for years, and so has illicit drug overdose death. Other approaches are necessary in order to reduce the number of incidents of illicit drug overdoses and illicit drug use in general.
Many illicit drug overdose deaths occur behind closed doors, including those of coffee shop washrooms. Boston Public Health Commission states that the biggest risk factor in overdosing is using alone. This is because an overdose cannot be recognized or responded to if it is unknown. Private spaces that hide the activity or non-activity of their occupants are dangerous to illicit drug users.
For our project, we will be focusing on the prevention of illicit drug overdose deaths in coffee shop washrooms. We will apply the rational choice theory of crime with the aim of reducing the occurrence of such deaths and illicit drug use in general in coffee shop washrooms. We believe that a reduction will result in a safer atmosphere for coffee shop attendees and staff. Rational choice theory states that humans make all their decisions based on rational choices, given with the opportunities that are present and available to them. It specifies that people are rational in character and that people calculate the likely costs and benefits. Their self-interest guides their decisions in order to maximize their benefits and minimize their losses. This theory argues that all decisions are made rationally, even though their actions may be seen as irrational. There is always some sort of calculative thinking that has taken place before an act or decision has been made. They make their decisions by predicting possible outcomes. Bathrooms provide users with private areas where they are not disturbed and go uninterrupted. Since public washrooms often go unchecked, they can be the ideal spot for users to use. If they are presented with the option of choosing a bathroom with one or more stalls, they often go with the washroom with one stall for more privacy. That way, they are not worried about someone walking in on them. Some would rationally choose washrooms indoors to protect them and their drugs from environmental elements which could affect the potency of their drugs. Ron Clark has come up with 3 broad configurations of factors which affect the variation of the rate of crime. The first revolved around increasing the effort every man would have to expand in committing a crime. That involved target hardening, such as defending objects like buildings and people by strengthening security, and access control by making it difficult for predators to approach targets, and also deflecting offenders, encouraging them to act in a legitimate manner, and lastly, controlling facilitators. The second factor revolved around increasing the risk of offending through screening of people, formal surveillance by police, security guards, and others, surveillance by employees, and natural surveillance, aided by the removal of obstacles, adding CCTVs and lighting of stores. Finally, reducing the rewards of crime, itself composed of target removal, property identification, and rule setting. This would ultimately make it harder for offenders to commit a crime. If coffee shop washrooms were more visible, were monitored by an employee, or if they had cameras outside the washroom doors, along with other preventative measures, people would be less likely to use drugs in washrooms because they know the coffee shop is monitoring public washroom use. The awareness employees have of who is in the washroom and how long it has been can be a key preventative measure.
A 16-year-old named Guinevere Staten fatally overdosed in a Port Moody coffee shop washroom in August this year.
We took a look at the coffee shop washroom where Miss Staten passed away in. Here is some footage of that location. The washroom was located at the end of a long hallway around the corner, and there was no buzz-in or lock system.
The ultimate goal of CPTED, also known as crime prevention through environmental design, is to reduce specific crimes such as drug use and overdose in washrooms, and the fear of them by changing environmental design. SEPTED is a creative inquiry into the design and management of human activities. Security problems and safety vulnerabilities are anticipated and designed out from the beginning. Potential offenders and users pick up on environmental clues that tell them this is a safe place or this place isn't, and act accordingly. The two main points of SEPTED that we will be applying to the design of a coffee shop bathroom are natural access control and natural surveillance. Natural access control creates perceptions of risk in offenders, and natural surveillance facilitates observation so users can see offenders and offenders can be seen.
The goal is to provide a cost-effective washroom that allows for maximum function in minimum space, so that we can provide a safe, accessible, attractive, and easy to maintain washroom. To provide a lock that authorities can open in the case of an emergency, and to adhere to the standards of those who are disabled. To increase the visibility of washrooms by removing the use of hallways where possible, and including LED lighting in hallways if they are necessary. And to establish a monitoring plan for maintenance. A uniform approach would entail communication between staff members and consistent washroom policies.
Additional solutions include training business owners, staff, and the public to recognize signs of overdoses by providing training and placing messages in places such as washrooms where people are likely to use drugs. Another possible solution could be a set policy on how to deal with washroom garbages. If one were able to lift a bin easily, they could avoid having to have much contact with the bag, thus limiting the possibility of touching a needle.
Some of the ideas we had for improvements for washroom safety and prevention of illicit drug use include the following. A printed cleaning schedule costs 50 cents and a plastic holder costs $10.79. A basic toilet paper holder costs $4.94. A large round one that holds multiple rolls costs $44.89. Each encourage employees to check washrooms more frequently. To print a poster yourself, it costs about $5, and to have it professionally printed, it costs $25. Each 60-watt LED light bulb costs from $1.97 to $3.97. You would probably need 4 light bulbs to light up a single washroom. A plain, lightweight plastic garbage can costs $19, and the equivalent one with a lid and wheels costs $49.99. An additional washroom key costs about $3, and a bathroom buzz-in kit costs $152.98. Occupancy indicator locks cost about $30, and locks for baby change tables to reduce use of illicit drugs on their surfaces costs about $11.99. If you find that there is a lot of counter space, it would be smart to remove extra table space, and it would cost $129 for a sink without counter space. If there's a hallway leading to the washroom, there is a camera and light package which costs $49.99.
By making coffee shop washrooms harder to use illicit drugs in, we believe that illicit drug use will be displaced territorially and possibly tactically.
We think it will make transient or homeless people use drugs in other public places like parks, alleyways, or other public washrooms, and push people to use their homes and at the homes of their friends or relatives. As studies show, they usually use there when there's such opportunity available.
We think that our ideas may cause tactical displacement, such as the use of drugs that are easier to hide or those that do not have an odor. We believe that these changes will be successfully countered by our prevention mechanisms.
Based on our research, we believe that these solutions would be a good first step in reducing the rate of overdoses within the washrooms at coffee shops. As a society, we can't afford to see the amount of overdoses nearly double in a year, and we need to take preventative measures to deter and hopefully eliminate this issue in the future.